A premature ventricular contraction. A premature ventricular contraction is caused by an ectopic cardiac pacemaker located in the ventricle. PVC are characterized by premature and bizarrely shaped QRS complexes that are usually long, typically more than 120 milliseconds, and appear wide on the electrocardiogram. The arrhythmia is characterized by the following abnormal rhythm. A normal beat is followed by an extra beat from the ventricle. This is followed by a slight pause and a beat that is more vigorous than usual. You can see this is the normal beat or normal QRS complex, PQRS and T complex, and this is a bizarrely complex which is premature ventricular contraction. After that, there is a pause in which the ventricle is filled with extra blood and the next beat is strong. This phenomena may be either bigeminy or trigeminy. What is mean by bigeminy and trigeminy? In bigeminy, the first beat is normal and second beat is followed by an abnormal premature ventricular contraction, and in trigeminy the first two beats are normal and the third beat is followed by premature ventricular contraction. So this is called trigeminy pattern and this is called bigeminy premature ventricular contraction.